morning and welcome to Village in Motion. I'm Marcia Boyles and I'm delighted this morning to introduce our first program in a new series called The Doctor's Inn. And this is going to be each month, we hope, for some length of time. So I'd like to begin the program today by introducing my co-host and co-producer, Dr. Sethi. Dr. Sethi, we're excited about this program, and I thought we might want to start today by talking a little bit about your background, because I think it is very pertinent to our program and our program objectives. So let's start by you telling us about your background.
Thank you very much, Marcia. And for all our viewers, we hope that this will be a very interesting and informational program. So my background, of course, is been largely in academic medicine for about 20 years in affiliation with Georgetown University, and also with Virginia Commonwealth University because of my practice in Fairfax. And I've been professor at both of those institutions in a clinical capacity because I have been in practice in the recent past. My interest in medicine, of course, is first and foremost as a patient advocate. And I strongly believe that, just like everything else, that the public should be informed. And so medical education has been a passion for me, both for those that I've taught and for those that I serve in terms of providing care. The more information we give you, the more we educate you about the medical problems, you'll be more engaged with your health, and I think that would be my primary goal for you.
Well, I should probably also add that I come from academia as well, and that all of my professional life has been in higher education also. So our objectives are exactly the same in terms of providing education to the degree that we can. I think, you know, we are excited about this, and I think the community is looking forward to it.
Well, we sure hope so, and I think that we should mention at the outset, this is an educational forum meant to improve the knowledge base, but clearly not a replacement for the advice that you will get from your physician, but make you more informed as you work with your physician.
All right, I think that's an important point, that that when it comes down to personal questions, we still need to go to our physicians for our answers.
Yes, absolutely.
All right, now the other thing that you and I have talked a bit about is the fact that if folks have particular areas of interest or concern, that they should get in touch with me to let me know what they would like to hear on this program.
Absolutely. We need to be completely open-minded, because I think that's the best way to serve our constituency and our viewers.
All right. Well, I think with that introduction then, both in terms of your background and in terms of the objectives of this program, I think we should begin with the topic that we decided upon, which is skin. That's clearly something we all have, both men, women, and of all ages. So let's begin with the topic of skin.
Sure.
What would you like to tell us about it?
So, you know, when we think about the skin, we think about it differently than our organs, but the skin really is also an organ. And believe it or not, it is the biggest organ in the body. The skin covers 20 square feet. It seems hard to imagine.
20 square feet?
Yes, because it covers every part of your body.
Wow.
That is visible, is covered by skin. The second thing that is so interesting is it's also the heaviest of all the organs. It weighs about 6 pounds. Now, we don't often think of skin in that way,
no.
But the moment you think about how significant it is as an organ, you would immediately become more attentive to the skin than take it for granted.
We don't even think about skin as being living.
That's right. That's right.
Okay.
Yeah. So just like everything else about us human beings, as we get older from the moment we are born, our skin begins to age with us. And I think that as we talk about how that happens, it's important to think about the different parts of the skin. So our skin, as we look at it, if you put your hand out and look at it, you see a surface. So this is what is called the epidermis. The epidermis is very, very thin. It's paper thin. So sort of think of this like saran wrap or plastic wrap. That's how thin it is. And it's important to have that perspective, because when you know how thin it is, then you know how easy it is to hurt it. The layer beneath the epidermis is called the dermis. And the dermis is much thicker. That's really the part of the skin that is protecting the deeper tissues. And this is the part that contains the collagen. And then the part below that is the cutis. And this is sort of the subcutaneous tissue for the skin. So the reason it's important to think of it this way is because when we think about what are the major changes that occur in the skin with aging, they are first and foremost thinning of the skin. And my grandmother used to say this. She used to say to me when I was a child, if I would ask her the time, she would say, you don't need to look at the time. You can count the seconds. She'd put out her wrist and say, you see this blood vessel here? You see how it goes up and down?
Throbbing.
Yes, and it does it 60 times a minute. That's 60 seconds. And the reason it was so visible is because the skin becomes thin. So the thinning of the skin, then this is why the structure becomes important, because this is so thin. As we are aging and it's becoming thinner.
It's the epidermis that's becoming
that is correct.
thinner and thinner.
That is correct. So then it becomes more susceptible to injury. I always tell folks, think about your skin like that of a baby. You really have to baby your skin your whole life. And as the lifespan continues to increase, it becomes more important. So what does this mean practically? So the thinning of the skin then translates into the following. If you're walking and you bump into something, you can get a contusion, or if you hit a sharp corner, you may even get a cut, what we would call a skin tear. So a skin tear is like peeling back the plastic wrap off a dish. So the skin peels and you see a skin tear. Now skin tears can be small or they can be big. They're very common, and I'm sure many folks have experienced them or know of them. In addition to the thinning of the skin, the second thing that happens is that the skin becomes lax. So the second layer of the skin, which is the dermis, just beneath the epidermis, begins to lose its firmness. And it is because there is now loss of collagen. So if the question comes up, how can we replace the collagen? I'm sure you've seen many, many advertisements which speak about restoring collagen. I can't tell you if or not they do. I know these preparations are on the market, and we'll speak in a little bit about, how the dermis, what affects the dermis principally, other than the fact that it's not quite as firm anymore. So what this means then is, when you cut yourself, say you accidentally cut yourself with something, and blood begins to come out, that means you've gone beyond the epidermis and you are actually in the dermis. And when you see a deep cut, you can see flesh, what looks like flesh underneath. And so that flesh, what you're seeing, is principally the dermis that is now being cut. So
that's where the blood vessels are.
That's exactly right.
No blood vessels in the epidermis.
That is correct. And so the dermis really houses the blood vessels, the nerves. You know how we feel things with our fingertips, our hands. That blood supply is in the dermis. That's where the blood vessels are. That's where the oil glands, the sebaceous glands are. So really the dermis holds everything, and it props up the epidermis. So when we think about it in that way, and then we think about aging, and we know our skin is becoming lax and it's becoming thinner, normally the skin as an organ serves a very important function, or I should say functions. So the one function is to protect us from the environment. It's the reason you put on sunscreen, right? It's the reason why if your hands are wet, you want to dry them out so that your skin doesn't become wrinkled just from being wet. Okay? So it protects us from the external environment. But it really does much more than that. It also protects us from infection. And so keeping the skin intact and good is very important. There are all kinds of infections that can occur. The skin normally carries on it organisms. So anytime there is a break in the skin, there is a likelihood that an infection can occur. This can occur when there's such an ordinary task that people enjoy here as growing their garden. If you don't wear gardening gloves and you're doing it with bare hands and you get a little cut, you can get an infection. So as one thinks about the skin, one has to think, why does the skin look different in different people? And there are many variables with regard to that. With regard to wrinkles, which are of concern to the whole world, there are people who start trying to prevent wrinkles when they're in their 20s and 30s, and more power to them. Some of these, there are two factors. There are the external factors, and then there are the internal factors. So let me just address the external factors because they're simpler. So external factors are things like smoking, sun, all of those things, you know, harmful elements. The internal factors, which determine wrinkles principally, for instance, are largely genetic. They're largely genetic. So if in a particular family people wrinkle at a certain age, there is a greater possibility that coming from a family with early wrinkling, that individual is going to wrinkle early too. You can still modify it because if you smoke, that's going to make the wrinkles worse. And if you're out in the sun a lot, on the beach a lot, and you're not wearing any sunscreen, that's likely to make it worse too. So it's actually not very complicated. It's a matter of thinking about your external environment, which you can modify, and your internal environment, which you actually cannot. Because we are born the way we are into the families that we are, for better or for worse.
Okay, can't do much better families.
Right.
One of the things that I was wondering about when you were talking about the epidermis, aren't there with aging sometimes kind of spontaneous tearings?
So spontaneous tearing,
I don't know whether that's the proper term, but a tearing just by stretching or moving or...
Generally, when that happens, it's usually because there's some friction. There's friction with something else. Okay? So the friction can take many forms. So if the skin is dry, one of the really important things to do for the skin is to keep it well hydrated. When the skin is dry, as you know, if you scratch, you'll see flaking. So the skin cells regenerate or die off and then regenerate in about a month, give or take.
Oh, is it?
When one is younger. And then as one gets older, the cells regenerate much more slowly. They may not regenerate for 40 or 50 days or even longer. So, you know, when you hear people talking about exfoliation and getting the dead skin off, it allows the cells to regenerate, and the regenerated cells are obviously going to be better equipped for everything. So there isn't spontaneous tearing, but whenever there's any friction, whether that is simply a fingernail or a hand, you know, scratching on dry skin, or if it is just bumping into an object,
or tight clothes even.
Less likely. There's still got to be significant friction in addition, or opening a kitchen cabinet and you don't even notice it. And people will often say, I have no idea how that happened. And they're probably right, because it doesn't take much. So one of the very important ingredients in maintaining healthy skin is to keep the skin well hydrated and moisturized. So hydration and moisture are two words which seem synergistic. They seem like they're companions, and they really are. So as clinicians and doctors, when we see somebody who is dehydrated, what we see is that the skin becomes tent-like. I remember when I was in training, one of the things that I learned as a nephrology fellow was when you're looking for dehydration, you pinch the skin. And when you pinch the skin on the forehead, it stays up like a tent because it doesn't fall back, because it's not hydrated enough.
And that is an indication of systemic.
That's correct.
Dehydration.
Systemic dehydration.
Interesting.
Yeah. So in addition to hydration, when we use moisturizers, they have a similar effect. So when we moisturize, my experience has been that most people, when they think of moisturizers, particularly women, they're thinking about putting something on their face.
Right.
Right?
Cream.
Yes. So whether they're hydrating creams or gels or whatever they are, they're thinking about their face.
Right.
But guess what? If we've got so much skin and it's everywhere, the face is but a small part. It's the part when we look at each other, we make eye contact, that's what we see.
Well,
We
and
see
it's the
face.
part we worry about. Yes, that's right.
Yes, but there's the rest of our skin to think about. The skin that's exposed to the elements is much more susceptible to tearing, to infections.
Okay.
So, and I would make a pitch that as we think about moisturizers and lotions, in many places now, in addition to the soap or the cleanser, you'll find lotion. So what do people do? They wash their hands, and then they take the lotion, put the lotion on their hands. Right? The part that gets neglected a lot are the feet. And I wanted to make a special pitch about the feet. So just like you hydrate the rest of you, think of your feet. They're carrying you everywhere your whole life. And the feet deserve our attention and respect. So what exactly should we do about our feet? My recommendation is, please look at your feet every day. Now, I know that I recommend to everybody when you're walking, make sure you look down so that you see what's in front of you. And you may see your feet at that time, but that's not enough. In addition to looking at the top of your feet, you need to look at the soles of your feet, right? Because the sole is what is touching the ground, it's what's touching the shoe, constant friction. And so the skin of the feet is particularly likely to get a bunch of problems, and we've all heard about, know them. You know, we've got corns and calluses and so on. So we really do need to be attentive to our feet, particularly women, because women tend to wear shoes that are pretty to look at, but not necessarily the best for their feet.
Right. Although I think fewer and fewer of us have those vanities as we age in terms of shoes.
Yes.
All right. This is interesting. So you're suggesting that we also use lotion on the feet?
Correct. Yes. And if you have difficulty looking at the soles of your feet because there may be arthritis or some limitation in the joint, then one of the easy techniques is just to have a hand mirror. Put that on the ground underneath your foot and you can see. And remember to look between the toes, particularly important if there is diabetes, because those are the areas that can be affected. And in addition to fungal infections of the toenails, you can get infections between the toes or the feet, anywhere really, but particularly there. Any area, the other areas that are vulnerable are wherever there are folds. So, for instance, the armpits are vulnerable in that way. Parts of the chest for women, the back, when you look at the back, what we would call the gluteal cleft, the cleft in the back, again likely to get infections. So areas need to be clean and dry. The skin everywhere needs to be clean and dry.
All right, I think the obvious question then, the follow-up question would be, what if you see something that looks like an irritation or whatever? What should one do?
Whenever you see irritation, the first thing you have to do is you have to do an assessment on yourself and decide, is your skin wet or dry? If the skin is very dry and it's irritated, then you need moisturizer. And you can get a rash just with dryness, and you can get flakiness of the skin. Yeah. But if you see that there's dampness, and then in this case, the area will make a difference in terms of your thought process. So if it's in your back, so because that area tends to gather moisture, that's why, you know, when folks are sick and they're laying in bed for a long time, they tend to get bed sores because the area is moist. For that reason, that area needs to be kept dry. It really needs to be kept dry. So if you notice that there's moisture there, you need to keep it dry and clean, and then please go see your doctor. That needs to be attended to very early on. The longer you put it off and procrastinate, the more difficult the healing will be. It will heal, but it may take a long time, may require the services of a wound care center. So whenever that happens, please look. Same thing is true if you get, say, irritation of the legs, the areas where we tend to see this a lot. So
any particular part of the legs?
More often than not, it's the lower leg, and there's a good reason for that, the lower leg and the foot. There's a reason for that. Our circulation, as you look at it, as we go in the internal organs, we've got bigger blood vessels, you know. Say it might be as thick as my finger, but as you go to the feet or to the hands, the blood vessels become smaller and smaller, proportionate to that size of the body. So the smaller the blood vessel, the greater is the risk of compromise. So if the circulation is not good, for instance in the legs, and you get irritation, you get skin breakdown, and an ulcer actually occurs and there's a wound, it's going to take that much longer to heal. So it needs a physician's assessment. Is the circulation good? If the circulation is not good, then that's going to be problematic, and we may need to have a much broader approach than just looking at it as a simple wound on the skin or irritation on the skin.
Okay. All right, that certainly makes sense. Are infections of the hands frequent?
So where we get infections really depends on what we are doing. Infections of the hands can certainly occur. They come to attention much faster because people are going to look at the hands and going to say, oh, this doesn't look right. And they're going to come.
Be more
and they're going to
aware
get the attention. Absolutely. It's the infections of the feet that don't get as much attention.
All right.
And there are two reasons for that. The one is they may not be, you know, we may not be looking at them as well each day. And the second is that just as the blood supply to the feet and the legs may be compromised, the nerves that go to those parts of the body, there may be neuropathy.
Right.
And so with neuropathy, you may not even feel that there's something going on there, and you may be unaware for that reason.
Yeah.
So yes, you can see infections of the hands, absolutely. I see infections in folks who've been gardening. Not unusual.
Yes,
so
although I suspect most folks don't garden, but yeah, and I think it just is obvious to us very quickly if there are infections of the hands. Okay, all right. Well, we're down to the last few minutes here.
Okay.
What else would you like to tell us about skin?
So my usual thought is that we should leave our viewers with something positive to think about moving forward. So we hope that you'll think about your skin as being the biggest organ in your body, because you know what? It is. And it's one that's with you your entire lifetime. Care for it well, no matter what stage you are in your life. Protect it from the elements if you're going to be outside in the sun, and I do recommend 15 minutes of indirect sunlight every day for indirect sunlight, and direct if you can handle it, because that's how the skin makes vitamin D. The skin has additional functions. So the vitamin D, the skin needs vitamin D and the sunlight to make it work for you. The skin also, as you know, when you go out, you sweat. Right, so that's the body's way of losing heat from the body. So think of your skin as being an active organ, not just a plastic wrap that covers you. Keep it clean, keep it dry, keep it hydrated, use moisturizers, and when you see any signs, and we didn't talk about skin cancers today, but when you see any signs or any abnormalities, new moles that are growing, please see your doctor, or if you have a dermatologist who does skin checks for you, please go and see them. Use moisturizers on all parts of your body, particularly with attention to your feet. Keep yourself well hydrated, drink plenty of water, but please don't drink it at bedtime. You'll not get dehydrated at night.
I think we've long since learned that. Yes, absolutely. All right, Dr. Sethi, I think this has been interesting and helpful. Let's talk a little bit about what we are intending in terms of the next several programs in this series. We have talked about muscles.
Yes.
And what is happening to us with muscles. I think we all realize that we're losing strength for sure. Right. We've talked a bit about bones, which you feel is a very serious and relevant topic.
Yes.
We'll talk about bone density a little bit. Joints clearly are a major issue with a number of people as we age. So I think those are the topics that we'll be coming up with. Are there any that I missed here?
No, I think you got the ones that we had spoken about, Marcia. Mm-hmm. And once again, I would encourage our viewers to please engage with us. Tell us what you think. Mm-hmm. Tell us what you would like to hear about. If you think we need to prioritize something that is important, and if you don't tell us, we certainly won't know. And I know that you want to tell us what you think, so please do so.
All right. I think that's a good way to stop. I think we'll stop now. Thank you, Dr. Sethi. I think this has been fun, and we will continue. I think we could also add that this program will be on the second Wednesday of each month. So the doctor's in on the second Wednesdays of each month.